An alarming medical trend developing in the state of Mississippi. In recent weeks, 8 pregnant women who were unvaccinated have since died from COVID-19. Now the State Department of Health is investigating. I'm joined now by Dr. Michael Errico. He's a critical care physician at Singing River Health in Pascagoula, Mississippi. Doctor, good to have you on this morning.
Thanks for having me. Good morning.
So I mean, the good side of this is that all of these women's babies were born premature but are alive. Sadly, though, the women died. And listen, we've been talking about this for some time because there's been concern out there that the vaccine might be dangerous for pregnant women. The data has shown it's not. And yet, in these cases, you have women, in effect, fearing the vaccine more than COVID and then, unfortunately, lose their lives. I wonder how you try to get the message across.
I think the message that we try to convey across the board, even with pregnant women, is that, yes, the vaccine is safe. And as you had mentioned, the studies prove that. It was something that we have to still try to implore people, educate people on, especially those that are pregnant. It is a very unfortunate circumstances that 8 have since passed from this. It's still something that we need to educate those about and encourage them to get the vaccine despite being pregnant.
It's amazing the babies were born safely. Tell us how they're doing.
So from what I know is that the babies are all healthy. They were mostly delivered emergency section. I do not know if they have had any complications or signs and symptoms of the virus, but I know they are all healthy and they are all thriving and doing very well.
Yeah, and I know that some of them are not in your hospital there, but it is good to hear that piece of good news. Big picture, I want to ask you, you heard the president yesterday now pushing towards mandates for vaccines, any company, 100 or more employees, etc. As a doctor, do you think mandating is now the way to go to try to get to those people who are still refusing?
I don't think so. It's something, obviously, it's in its infancy that he stated yesterday. It would be highly encouraged, obviously, to help decrease hospitalizations, opening up more of what we're allowed to do here in the hospital, not just with COVID in our ICU. But with it being in its infancy, I think we have to, again, educate those of the importance of getting the vaccine. Mandating right now, I don't know how well it will transpire across the board, both in a healthcare institution, as we have seen before, as well as other private businesses. I think it's something we have to assess on a daily basis and continue to encourage people to get vaccinated.
I wonder what's working. We just showed on the screen the vaccination rate for the state of Mississippi. It's just over 40%, which is far below the national average. This is for fully vaccinated people, which is, as you can see on the screen, 53.4%. So what works then? You say education. What is getting through, in your experience, to folks who are still refusing to take the shot?
Unfortunately, I think what's taking those who are still hesitant about receiving the vaccine is they know someone or one of their loved ones has become ill with the virus. Yeah. That has just been my experience here at our institution, here at Singing River. Those drastic steps, I think, need to be prevented to allow somebody to get the vaccine or encourage them to get the vaccine. You know, this has been a hot button topic for a long time that we see since the vaccine has been out. And we just have to continue to push and hopefully encourage those that, yes, it is safe. Yes, the side effect profile is safe for those, even pregnant, and continue to try to work with our brothers and sisters and our neighbors and make sure that they're safe.
Well, I wish you luck, man. I know those conversations can be hard, and it's hard to convince folks, but you certainly see the results here of refusing to get the shot. Dr. Michael Errico, thanks so much.
Thank you, sir.